3 research groups have established high-risk factors for sexually transmitted infections among students and other adolescents. While one study reveals just about half of sexually active second-cycle students have fair knowledge of the disease, another finds only 36.7% of them use condoms. Yet, a third group suggests pornography is the most popular factor influencing sexual behavior among the youth. Reports on the worrying trends come as the world observes. So here's Chrissy Debre's report.
According to the World Health Organization, over 1 million sexually transmitted infections are acquired every day worldwide. It's estimated there are 357 million new infections from one of these 4 STIs: chlamydia, gonorrhea, syphilis, and trichomoniasis. 500 million people are having genital infection with the herpes simplex virus, and 290 women are having the human papilloma virus. Majority of these STIs have no symptoms, only mild symptoms, which may not be recognized as STI. Today, the world observes sexually transmitted infections.
My name is Rexenia Amado, and I did my study in the secondary Takoradi Metropolis. And basically, my study was studying the knowledge, perceptions, and practices of adolescents with respect to STIs and HIV/AIDS.
My name is Elise Teza Ejewa Oheneche. I did my research on the reproductive health needs and sexual behavior of the youth in the Ga East District of the Greater Accra region.
My name is Sonia Grace Jifa Koch, and I did a study to assess the knowledge, attitudes, and practices related to the transmission and prevention of sexually transmitted infections among senior high students in Ashedi Keteke sub-metro of Accra.
I used a questionnaire and I sampled 346 students.
My sample size was 150 students. I used students because it was easier to find more of the youth in one place.
We administered about 290 questionnaires to the senior high students in 2 schools in Accra.
In assessing the knowledge first of these adolescents, only 48% of them were able to correctly define what an STI was, meaning that the knowledge as compared to elsewhere was a bit low. I was a bit disappointed by that. You had individuals who also sadly believed that coughing, sharing plates, or sneezing were ways that they could transmit STIs among each other. So it shows that more work needs to be done with respect to the knowledge aspect of it. So looking at the relationship or association between knowledge now and their risk perception, we found that 43% of those individuals, the 48% of individuals who demonstrated high knowledge, 43% of them believed their risk to be low. One might look at this to say that, okay, those individuals know about STIs and they know how to prevent themselves against getting STIs, so that's why they perceive their risks to be low. We were also interested in now looking about the relationship and association between their risk perception and their sexual practices. So we asked about the sexual practices of these adolescents with regards to oral sex, anal sex, and vaginal sex. And it was found that 9% of these individuals were undertaking penile-vaginal sex. And interestingly, all individuals across these 3 categories of oral, anal, and vaginal sex believe their risks to be low.
Also found out that a lot of them were into pornography, and that was one of the factors. The major factor that I found was affecting their reproductive health and their sexual behavior. And they also had about 37% of them who had been forced to have sex, so rape. And for this percentage, most of them had been forced over 1 time, so between 2 and 3 times.
We found that fewer of the students knew about the lesser known STIs such as syphilis, chlamydia, and then Hep B. We also found out that a good number of them were sexually active, about 40% of them. However, these sexually actives were not using condoms. About 30% of them, almost 37% of them, never used condoms anytime they have sex. However, a few of them said they sometimes use condoms. Okay, and some of the reasons they gave were because they were shy to purchase these condoms from pharmacies. And also a good number of them said they do not know of any adolescent reproductive health centers. And even those who knew about such centers said they were not adolescent friendly enough. Also found out that some of them had some misconceptions about sexually transmitted infections and how one can protect him or herself. Some of them thought that even using oral contraceptives could help prevent you from getting a sexually transmitted infection.
All right, we want to have a conversation on the back of this. JoyNews is National Program Analyst, Adolescent Sexual Reproductive Health with the UNFPA, and Akosua Japan is also with the UNFPA. Good morning, ladies.
Good morning.
Thank you for being here.
Thank you.
So young people, obviously from the findings, are having sex. A lot of young people. That doesn't surprise you, does it?
No.
Not at all.
Okay. But the fact that they're not using condoms? Otherwise, they're not protecting themselves?
Exactly. I don't know, Akosia, would you like to say something maybe from a young person's perspective?
Yeah, sure, definitely.
Sure. Okay, so from a young person's perspective, it's really not quite a surprise that young people are having sex and not using condoms. It's like that because there's a lot of stigma when it comes to sexual issues or sexually related issues. So in the first place, when you talk about sex or anything related to sexuality, there is a stigma surrounding it. So for a young person to go to a pharmacy and say that I want to go and buy I'm buying a condom, it's even a huge barrier. It's so difficult. And I mean, how many of us can go to our parents and say, Mommy, please, I need money to buy a condom, or Daddy, please, I need money to buy a condom? And you would agree with the fact that young people don't make their own money. So how are they going to get a condom in the first place? That's one of the questions. And then the second thing is, for many young people, and as I saw in the recording, they are watching pornography. And because they do not get the sexual education from anywhere else, because it's such a stigmatized topic, pornography is a huge primary source of sexual education to begin with. And in pornography, what do they see? There's a lot of sex without even the use of condoms. And that forms their perception of what a great sexual experience should be. That it is more fun, or it is more satisfying when there is no condom use. So from there, and you have to understand that what we observe as human beings in our form of learning is more reinforced even without seeing it again. So there's more reinforcement from the images we see than even from reading or hearing from somebody. So if you're seeing a sexual encounter without the use of a condom, it informs there and then their subconscious and perspectives on using condoms. And so then they'll not even use the condom anyway, because in their heads, oh, what I saw was a great sexual experience without the use of condoms. So these things all influence the behavior of not using condoms during sexual encounters.
Ajo, I thought we're doing great in terms of education, because there's so many outfits and we've come a long way.
Yes, we have.
Our children should be making better decisions.
Mavi, I totally agree with you. We have come a long way, but there's still so much that has to be done. Ghana has moved from a place where issues of sexuality education were almost really taboo. They're still taboo somewhat, but we have advanced significantly. Young people nowadays have information and have access to all kinds of information. And that is why there's a need for structured, standardized information. Which really brings us back down to the issues of CSC. Because if you look in the video, the documentary, all the research that is being done, if young people had structured, standardized information about how to use a condom, what contraceptives mean, etc., then they will be able to take better decisions. So there's a lot of misinformation out there. Like Akosia said, if you watch pornography, first of all, probably not using condoms. So the whole issue of I want to raw, etc., is all in there. And with that kind of mentality, it means that even though you have knowledge about the use of condoms, you're probably not going to use it, because from what you see, people are not using it. And it's interesting to know that if you look at data like national data, the demographic health surveys or the maternal health surveys, even sometimes the Sentinel survey for HIV, you realize that young people will use it, a lot more young people will use it for a first time. But for the continual, consistent use, it really drops, you know, and that is where we really need to continue the education.
But why is that? Because then it means that they already know.
They know.
But they decide not to use it.
Exactly. One, for me, I would say that is the issue of the imagery that they see and the perception. You know, adolescence is a time where, I mean, we tend to forget that because of all the hormonal changes in your body, young people are at a point where they have to think and analyze a lot. There's a lot of peer pressure. So if you're going to turn on the TV and see all of this inappropriate material, which is going to continue reinforce, even though you know, will continue to reinforce the fact that sex is better without a condom, and you don't have to worry so much about it. It can be a nuisance, etc., etc. Sometimes there's a likelihood that people tend to go towards not using it. But I think more realistically also, as some of the issues that Kosia raised, the access, the stigma. I mean, it's so hard I saw a WhatsApp video where a girl went into a shop to buy a condom, and honestly, the feedback alone was such that, I mean, I'm sure she would never ever go into a shop to buy a condom anymore. So if we don't start as a nation to understand that we are in a different era from our parents, totally different era. We need the adults who are sitting in the pharmacies or in places where young people have access to condoms to start understanding that there's a need to change mentality. You know, there's a need to change. For instance, some of the feedback from some of the research shows that why aren't they using the condoms? You know, ideally they'll say carry a condom, you know, if you know you're sexually active and will need it. But you're perceived as a bad person. If my mom opens I can't even imagine if my mom should open my bag and see me carrying a condom. So we are coming from a certain mindset which needs to shift. And until we are able to shift, we are still going to see these lapses or these dips in condom use here and there.
I was just going to say before she came in with that angle that shouldn't this start from the home? At what age would the parents be okay if they saw a condom, for instance?
At what age? Like currently, I think at what age, if my mom was to see a condom, I think when I'm married, when she saw a condom, she'll be okay, fine. I mean that she'll feel some way, but then it's okay for her daughter to have a condom at that age. But the very important conversation should be around at what age should we start talking to our children about sexuality. And really it should begin once your child knows how to talk and then move around and understand. You should start talking. Start talking to him about aspects of sexuality. So not come and tell your 5-year-old how to use a condom or your 2-year-old how to use a condom, but you know, let him or her understand her body as she's growing or as he is growing, and his or her body is changing. He or she has to understand the changes in her body, because if he or she doesn't understand from the home where the parent has the best interest of the child at heart, she's going to find it from her peers. And the peers are people who want to show that they know, who want to show that they are the masters of the group. So they are not really thinking about, oh, how is this information going to affect my friend? They're thinking about, how is it going to make me look in the eyes of my friend? I would be the big girl, I'll be the big boy, I will get the girls. So let me just say, so even if it doesn't make sense, if it is not true, even if it's not validated, they're still going to talk about it to you. And then your child learns things that he or she is not supposed to learn. But when it's from the home, you understand that the home is the closest, like the home is the environment that we come back to. It's where we grow up. It's where we spend most of our time in. And the closest people right from birth by virtue of attachment is our parents. So if you're able to get that information from your parents, even for the fact that it is someone who loves you, validates the information. So that when I'm speaking to my friend says, oh no, you have to have sex because it would help you, it would reduce your menstrual pains. You'd be like, no, it doesn't work that way because my mother said A, B, and C. And you then tend to educate others. So once you have that information, it actually influences the sexual behavior of the child.
Yeah. Very good points you make there. Ajua, I'm thinking that as a parent, it's easy to talk to your child about sexuality, but to find out that they are actually involved in the act of sex and are now using condoms, that's like two different things altogether.
That is so different. You're right. And in fact, the whole conversation around a sexually active, it is a difficult one for a parent. So for instance, I'm a sexual reproductive health professional, and I find out that I have to start, because I have a 14-year-old, and I have to get to a point where I'm talking to him about sex. He's a boy. And I have found a way to be able to introduce topics to him, so that there are certain stages in his life he has gone through that I asked him, oh, are you sure this is, oh, mommy, appears to be a wet dream, and blah, blah, blah. And I'm like, oh, really? Are you sure? Yes, yes. And so he understands the issues. And I was very happy about that. I was like, phew, you know. But like you said, if he were to come to me and tell me he's sexually active, first of all, as human beings and as Ghanaians, we always have a moral side of things. But whether a child has decided to become sexually active or not is based on the kind of information you have given them, the way they decide to go ahead and live their life. They will make one of both or one of two decisions. But if they decide to be sexually active and you find out that they're sexually active, for me the problem now is, are they practicing safe sex? You know, are they going to make sure that they're not going to get some young girl pregnant before they can both finish school? Are they protecting themselves against HIV and AIDS? Do they have the information and the right information to be able to make those decisions? I'm happy to say that at least with a lot of the partners we work with, there's always a component of, at least in some of the partners we work with, a component of parent-child communication. Because we realize that it's important for even the parents to be able to feel comfortable enough to be able to talk to their wards. Akosia is fortunate because her mom understands the issues, and even then, I mean, she's able to kind of address some of the SRH or the sexual reproductive health issues. But a lot of parents still have to be comfortable to be able to talk about it. I think there's a huge misconception about the issue of sexuality education, or what we say comprehensive sexuality education. Like Casey said, Akosia said, once you start talking about, once a child develops the issues of sexuality, and comprehensive sexuality education is supposed to be age appropriate and culturally sensitive. So the Ghana Education Service will tell you that we teach CSE right from kindergarten. When a child is in kindergarten and they start learning about their hands, their legs, their wee-wee or whatever they choose to call it, and knowing that that is the actual thing, we have started a process of sexuality education, which is appropriate for that age. So by the time they get to JHS, for instance, they know that apart from their parts of the body, there are issues of peer pressure. Like she said, peers are very important. There are issues of how to negotiate, how to say no. There was one advert on TV I really loved. No means no means no means no. They have to understand how to make no mean no. You know, and it's a skill you have to learn. It's all part of comprehensive sexuality education. So if we can be able to teach our kids at the school level, if the parents can reinforce the messages at home, if our teachers will also not be shy, you know, and be able to teach CSE as it should be taught, I think we will have better outcomes when it comes to issues like condom use and STI prevention, etc.
Of course, you're in the senior high school. How is it easy? Who is easier to talk to? The parents or a teacher in the school? Because you spend a lot more time there.
This is funny because it takes me to a question I was asked in school. So I was the second assistant prefect, and then at mass, the father called the first prefect, the second assistant, and the school prefect to the altar and asked us, so if we were to get pregnant, what would we do? The school prefect said she would speak to the school counselor and get counseling and everything. And I was saying in my head, you are lying. The second one said the same. When they asked me, I said, I'll abort it.
Wow.
I was simply abort it because I was thinking, the school counselor, I cannot trust it. I cannot trust to tell her about what has happened to me. Will she understand me? Will she not go and tell others? And really, they were saying that they would tell the school counselor because it was in front of people and their school prefects and they have to say the right thing.
Yeah.
But really, if they had gotten pregnant, they would have also aborted it quietly so that nobody finds out. You can't tell the headmistress because the headmistress is likely to call your parents, make it a huge issue. Because you're a school prefect, they'll say that you can no longer be school prefect because you have conducted yourself badly. So there's nobody around that you can say you can trust to speak to, not even a teacher, because you don't trust that the teacher really understands what you're going through. And not your parents, because you are already scared and afraid of your parents. Because, I mean, in our society, we largely see our parents as a huge authority figure that you do not want to disappoint. So it is very easy for somebody to go and speak to her friend because she feels that the friend understands her.
Yeah.
They
probably have been through it.
Exactly. The friend is going to give me a quick solution to it. And it's not going to make it such a huge issue. I trust that she's not going to tell the other girl. She will keep quiet. She's my real friend. And so people trust their friends more within those settings, which is very wrong and very bad, because we should create a system where, and it's a girls' school, so we should create a system where all the teachers, we can trust the teachers, we can trust the headmistress to speak to, we can trust the school counselor. And then that's the thing, like the school counselor is supposed to be there to talk to me, you know, to be the one I go to. But
so was it just a perception, or you had actually seen signs that you couldn't trust them?
I had seen signs.
Okay.
And we had all seen signs. Like in our school, we had seen signs.
Okay. So the real question I want to ask is, how do we change that? How do we make somebody accommodate students so that they can talk to them about just about anything?
Or anything. So one thing my teacher, after I left school, one thing she started doing was inviting someone from Planned Parenthood Association of Ghana to come and actually talk to the students about reproductive health and sexual health. So that made me understand that she now understood the issue. She now understood why it's important to talk about sexuality and sexual and reproductive health and rights. So the very first thing I think is to make teachers, make headmistresses and people in authority, adults, understand the issues. Let them understand that this has to be a change of perception. That the age now is different from the age before.
Yeah.
That adolescents now are exposed to a whole lot of things and need to be guided. That's the principle. Like that's the main word, guidance. Need to be guided on how to behave sexually and not.
Yeah.
And from that understanding, there's a more welcoming, aura that is created so that people can come to them with problems.
Joy, is there a place where parents can get information, get the education? Because sometimes parents need it before you can pass it on.
Exactly. I think in the last couple of years, what has happened is various NGOs, sometimes government, and then the Ghana, the school health program of the Ghana Education Service has tried to incorporate sessions of sexual reproductive health into like PTA sessions, where they would, when parents are gathered, you can give information. At the community level, there are all these creations of community awareness creation on CSC, and normally they will have sessions for parents. I think it's a lot of little interventions which are currently going on, but I think they are beginning to make some headway.
Okay.
We still need health service providers who are youth friendly. So Ghana Health Service has been training, I know at least with UNFPA support, has been training health service providers to be youth friendly. So you go to a facility, there's supposed to be people who will see a young person who's come to ask about a condom and not, do the eyes or kind of thing. And I think the more and more we adopt some of these, the better it's going to be. I would also like to add that currently there's a system whereby Ghana Education Service, Ghana Health Service are working together to ensure that first year SHS who are going on first year screened, they're all screened. But then there's a move to transfer the sick base in the infirmaries in the schools into a more youth-friendly facility. So they're training nurses who will be in the facilities who are youth friendly, and ideally you should be able to go to this new health service person with your information, etc.
Okay.
So I think there are a lot of little interventions. With the parents though, you have to continue to do more at the community level, with the PTAs, etc. And we hope that at the end of the day, we'll be able to get more people and more parents who are more comfortable about talking about sexually reproductive health issues.
All right. I just want to say that, you know, parents are on the move. We hardly have time. Even the PTA, we don't go. So
it's true. It's true. It's true. It's true. It's true. It continues to be a challenge, but I think we are gradually seeing a new phase of parents who are younger, who understand a little more, while another phase is also moving along, let me say moving along. And we hope that as these changes happen, we'll be able to see more and more parents more educated.
Is it okay if a parent, as part of the packing process, packs some condom for the child who is going off to secondary school? Is it a license to go and have sex, or it's just a way of helping the child out? What do you think?
That's a good one. Ideally, it shouldn't be a license to have sex. If the child understands that there are issues or times, you know, where they may be tempted to have sex, but if they should have sex, they need to use a condom, and that is it. But it really depends on the parent and how they feel about sexuality issues.
Can I put you on the spot? Would you do it?
Would I do it? Give my son condoms to go to school? I wouldn't give him condoms, one, because some of the schools have really strict policies about condoms, etc. But I would make sure that he knows that if he needed to use a condom, where to get it.
Okay.
That for me is the key thing.
Okay.
Though I would say, no, you know what, you're not ready to have sex.
Yeah, that's the Ghanaian parents.
You know, you're not ready for sex. But if for any reason, because there's so much peer pressure out there is really a lot of peer pressure, which makes young people do things they wouldn't have normally wanted to do. You know, so you have to be prepared that those times will come. But when they come, what you do? When they come.
All right. Thank you so much.
Thank you
I wanted to ask, but I don't have time. Whether packing the condom would make a difference, because you are. Would it make a difference in your?
In my.
Take yourself back to no.
Really, for me, it wouldn't have made any difference.
All right. Thank you so much for the thoughts.